Using the Odyssey diode lasers to trough and recontour gingival tissue will immediately result in clean, distinct access to margins, with no tissue rebound to affect the final preferred tissue level. This allows you to confidently capture the margins during impression making, resulting in fewer retakes and eliminating the need for retraction cord. It also means you can contour the margins and the level of preparation with confidence in long-term stability. Following final preparation of the tooth, cleanse the area and rinse with a light spray of water. Lightly dry the area with a low volume flow of air. Set the Odyssey diode laser power to 0.7 to 2.0 watts, the mode to continuous wave, and initiate the fiber tip. Lightly contact the sulcus lining just inside the crest of the gingiva, angling the tip away from the preparation. Using very light pressure, begin lasing as you make small paintbrush strokes around the circumference of the tooth. Create a small trough between the tooth and gingiva. Remove just enough epithelium to obtain visualization of the finish line and allow the impression material to flow beyond the prepared margins. Always use the lowest amount of power necessary to reach the treatment objectives. The prepared tooth should now be ready for impression making. Ivoclar Vivadent recommends the use of a hydrophilic VPS impression system, such as Virtual, to optimize your final results and achieve an impression with accuracy and fine detail. The Odyssey diode lasers allow the clinician to extend the crown's clinical appearance quickly, efficiently, and without hemorrhage. Soft tissue aesthetic smile appearance can be refashioned and sculpted in minutes with virtually no hemorrhage and confident positioning following healing. After the patient has been given anesthesia, insert a periodontal probe into the sulcus and measure the depth from the crest of the gingiva to the crest of the bone. Note that measurement and reduce it by 2 to 2.5 millimeters. This is the amount of tissue you can now remove without infringing on the biologic width. Set the Odyssey diode laser's power to 0.8 watts. The mode continuous wave. Initiate the fiber tip. Always use the lowest amount of power necessary to achieve the treatment objectives. Proceed using short 1 to 2 millimeter paintbrush type strokes and move quickly while modifying the soft tissue level. Whenever possible, angle the fiber tip so that the laser removes tissue from the flat cleaved tip, but does not give you a blunted finish in the area of the crestal gingival. You can also recontour or bevel tissue that is too thick in the same manner. Always try to avoid accumulating gingival debris on the fiber tip to avoid creating a hot tip, which can result in charring or blackening of the tissue site. Keep the laser tip moving. Avoid maintaining the fiber tip in one area for a prolonged period of time, and do not use excessive energy. Avoid contacting or damaging the periosteum during lasing, and do not use the Odyssey diode lasers on alveolar bone. Odyssey diode lasers can be extremely effective tools in the management of periodontal disease. Coupled with the laser's ability to reduce bacteria and effectively remove pocket lining epithelium and granulation tissue, the Odyssey diode lasers can serve as an effective modality in the adjunctive treatment of periodontal disease. The purpose of this procedure is to remove diseased or inflamed soft tissue in the periodontal pocket and to improve the clinical indices, including gingival bleeding, probing depths, attachment loss, and tooth mobility. The laser procedure is intended to be an adjunctive treatment to conventional scaling and root planing, not a replacement or substitution. Set the Odyssey diode laser power to 0.8 watts in continuous mode. Then initiate the fiber tip. Gently probe the pocket to get a sense of its geometry. After conventional instrumentation has been completed, calibrate the fiber tip to the pocket depth. Begin to lase the diseased epithelial lining. Always use the lowest amount of power necessary to reach the treatment objectives. Keep the fiber parallel to the root surface during lasing, or with the tip slightly tilted toward the gingival tissue in order to maximize ablation of the inflamed tissue. Keep the fiber tip in contact with the epithelium. Move the fiber in both horizontal and vertical directions, covering the epithelium and adjacent inflammatory connective tissue. Move the fiber smoothly and at a moderate speed. Debride all granulation tissue. You may use a fine water spray during laser treatment for rinsing. Remove plume and debris with the high-volume evacuation, which will also tend to cool the tissues and reduce the need for anesthesia. The total amount of time for this laser procedure is a function of the extent of the diseased soft tissue. In general, lase pockets 6 millimeters or less for approximately 30 seconds buccal and 30 seconds lingual, and lase pockets greater than 6 millimeters for 45 seconds. Another indication of the complete removal of granulation tissue is the beginning of oxygen-rich or red bleeding from the treated site. If the patient experiences noticeable discomfort, lower the power setting. Anesthetic may be administered. The presence of an abnormally attached frenum can result in localized gingival recession, create midline diastemas, cause ankylosing, and can possibly interfere with denture fabrication and wear. While it is a relatively common condition, using a diode laser to release a frenum is a much more efficient, patient-accepted, and clean procedure in contrast to more conventional scalpel techniques. To release a frenum with the Odyssey 2.4G diode laser, first check the level of frenum attachment by pulling the lip in different directions. Excessive attachment generally causes blanching of the surrounding gingiva. Either topical or local anesthetic can be applied depending on the clinician's and patient's preference and need. Using an initiated tip at 1 watt continuous mode, start at the most coronal aspect of the frenum and use a perpendicular motion with short strokes, maintaining tension to easily release fibers. Stop and check attachment by pulling the lip from side to side until proper release of fibers has been completed. By combining the tension of the tissue with the laser release of the fibers, a naturally diamond-shaped incision will be created. The clinician can appreciate the level of frenum release by pulling the lip from side to side and checking for blanching of the gingiva. It is recommended to limit incision to the soft tissue, not touching the periosteum or the attached gingiva. Use low settings to avoid charring or patient discomfort. Obtaining soft tissue lesions for biopsy or for removal is a simplified technique using Odyssey diode lasers. Once the patient is anesthetized, proceed to secure the mucocele with suture to better visualize the perimeter and apply tension to the tissue for more efficient lasing of the lesion. Use an initiated fiber at 0.9 watts in continuous mode and begin lasing the tissue at 2 millimeters beyond the base of the lesion using short brush strokes, starting at the front and finishing from the back side. Always maintain the tension on the tissue until the lesion is completely removed. Jarring of the tissue should be avoided and the margins of release should be away from the lesion margins to assure a pristine sample for biopsy. Hemostatic Assistance. Odyssey diode lasers can be used in a non-contact technique to reduce or stop hemorrhaging from a preparation or surgical site. This is an efficient and effective use of laser energy to initiate the coagulation process. Before lasing to stop hemorrhaging, remove excess blood from the area. Set the Odyssey diode laser power to 1.0 watts, the mode to continuous wave, and do not initiate the fiber tip. Place the fiber tip near, but not in contact with the target wound, lasing the bleeding area in a circular motion from approximately 10 to 15 millimeters away. Laser hemostatic control may require several passes of the tip over the target tissue, depending upon the extent of hemorrhage. This procedure illustrates how coagulation occurs by maintaining the tip in non-contact over the bleeding area. Inability to achieve laser hemostatic control after several attempts is a probable indication that a vessel greater than ½ millimeter in diameter was severed. The laser is ineffective in sealing such vessels, and other hemostatic techniques may be employed. Odyssey diode lasers can serve to expedite orthodontic treatment through a number of soft tissue procedures. Often, orthodontic treatment may be delayed or compromised due to target teeth being slow to erupt from the soft tissue or delayed passive eruption. The use of Odyssey diode lasers to expose surfaces of uninterrupted or partially erupted teeth can assist and accelerate the complete orthodontic treatment. Using Ivoclar Vividence Optrogate for cheek retraction and visibility, set the Odyssey diode laser power to 0.8 watts in continuous mode, and with an initiated fiber, proceed to cleanly remove the tissue from the labial surface of the cuspid by lifting a flap, as in this case, or cutting a window to expose the tooth. Odyssey diode lasers may also be used for hemorrhage control prior to bonding the bracket of the tooth. Prior to acid etching, remove excess blood from the area. Set the Odyssey diode laser power to 1.0 watts, the mode to continuous wave, and do not initiate the fiber tip. Place the fiber tip near the target wound, lasing the bleeding area in a constant sweeping motion. Laser hemostatic control may require several passes of the tip over the target tissue, depending upon the extent of hemorrhage. Once the hemorrhage is controlled, you can proceed with predictable placement of the bracket. Finally, weld the tissue with the Odyssey diode laser at 0.6 watts continuous wave mode and clean any remaining tissue tags with hydrogen peroxide. There are many situations where soft tissue modification is an asset to the efficiency and effectiveness of orthodontic treatment, accelerating treatment time, or simply providing an opportunity to achieve true occlusal and soft tissue balance. Odyssey diode lasers are the perfect adjunct to fulfilling the CAD/CAM promise of a quality aesthetic restoration in a single visit. Whether it is exposing a restoration margin for better detection by the optical impression or laser scan, recontouring inflamed or ragged tissue during emergency repair or at one-appointment restorations, or controlling hemostasis prior to adhesively cementing your restoration, the Odyssey diode lasers are your perfect partner. Upon completion of your preparation, you can use the Odyssey diode lasers to expose your restoration's margins from the tissue prior to optical impression to ensure preparation margin visualization. Odyssey diode lasers also promotes and expedites healing of surgically repaired or infected tissues, resulting in reduced healing time compared to traditional techniques. Odyssey diode lasers are also ideal for implant uncovering, excisional and incisional biopsies, fibroma removal, and abscess care. An additional benefit is its ability to reduce the pain and longevity of cold sores and Aphthous ulcers. A leukoplasia is present distal of tooth number 17 and requires to be evaluated. After the soft tissue area is anesthetized, the Odyssey diode laser, set at 1.0 watts of continuous power, is used to remove a distal wedge of tissue. Start at 2 millimeters from the lesion's perimeter by sectioning the tissue with small brush-like strokes, or mark points on the gingiva to delineate the surface of the tissue to be removed, and then connect the points with the laser tip. There should be minimal to no bleeding when using the Odyssey diode laser for tissue biopsies. But when there is bleeding or oozing of the area, hemostasis may also be completed using the laser in non-contact method. Use the Odyssey diode laser with an uninitiated tip at 1.0 watt continuous mode, and without touching the tissue, proceed in a circular motion to lase the area and help coagulate any bleeding vessels and seal the lymphatics. Minor gingivectomies or gingival recontouring can often be done using only topical anesthetic. In this particular case, the gingival tissue requires recontouring in order to properly restore the tooth. Using an initiated tip with a power setting of 0.6 to 0.8 watts in continuous mode, the laser is used with short brush-like strokes to remove the tissue. It is recommended to stop frequently to clean the excess tissue from the fiber tip with a water-moistened gauze. This will help prevent excessive heat accumulation and subsequent charring of the tissue. When larger amounts of tissue need to be removed, begin by marking points on the gingiva to delineate the surface of the tissue to be removed, and then connect the points with the laser fiber angled perpendicular or beveled to the tooth. For this case, the fiber should be maintained parallel to the tooth, contacting the gingiva using small brush-like strokes. Remember, the 810 nanometer diode laser energy is selective for soft tissue, and when properly used, its depth of penetration is not enough to damage hard tooth structure. Also, using a low power setting will minimize any potential charring. After completing tissue removal, hydrogen peroxide can be used to clean the excess tissue tags and surgical site, leaving the area clean with well-defined margins. The true key behind the Odyssey diode laser's design is passion for better dentistry. The Odyssey diode lasers offer you easy access to the most sophisticated, precise, and minimally invasive technology in dentistry. Having the Odyssey diode laser in the office will give you an expanded capability and an ability to perform more patient-friendly soft tissue procedures with a new sense of confidence and clinical versatility. Many patients, normally being referred to a specialist, can now be treated within the general practice. This will help protect and grow practice revenue, expedite case completion, improve office productivity, increase patient satisfaction, and reduce stress for the clinician and patient. The Odyssey diode lasers will expand your level of patient care. No other technology offers advanced treatment options with such simplicity in concert with the continuing upgrade of science, education, and the art of dentistry.